Hello, my name is Chris Barbary and I'm one of the chaplains at Floyd Medical Center. In this series of short videos, I will be explaining the Georgia Advance Directive, which has 4 parts. In this segment, I will explain Part 4. Part 4 is called Effectiveness and Signatures. This part is required because it contains the signatures. I'll explain more about that in just a moment. Once completed, an advance directive remains in effect until you complete a new one or until your death occurs. Section 5 of Part 1, if completed, remains in effect after death. At the top of Part 4, you have the option of putting an expiration date on your advance directive. Most people leave this part blank, but we want you to be aware of it. Typically, it is used if someone is completing a short-term advance directive that they wish to temporarily replace their original advance directive for a fixed amount of time. One scenario where this might make sense is if you know your original healthcare agent is going to be out of the country for several months. In that case, you might wish to complete a second advance directive naming someone else that will expire when your original healthcare agent returns home. Leave this top part blank if you want your advance directive to stay in effect until your death. If you want the advance directive to expire, write in your chosen expiration date. The bottom of Part 4 is where you sign the advance directive. Be sure your signature matches the legal full name you used at the top of page 1. While the document does not need to be notarized, 2 people must witness your signature and also sign the advance directive. These witnesses cannot be family members, cannot be named in the document, and cannot be part of the person's medical team. At Floyd Medical Center, this means no Floyd Medical Center employee is allowed to serve as a witness. Legally, this restriction on witnesses has to do with conflict of interest. You may use friends, neighbors, co-workers, etc., as long as those people do not fall in one of the excluded witness categories. You may complete the entire document except Part 4 without anyone else present. However, do not sign it until valid witnesses are present. If you are completing an advance directive while you are a patient at Floyd Medical Center, complete everything except Part 4. Then ask your nurse to contact the chaplain's office. We will be happy to review your advance directive and ensure it is completed correctly. Then our chaplains will attempt to find non-employee witnesses so you can complete the advance directive. Note that the witnesses are only stating that they saw you sign the document. They are not stating that they have any knowledge about your wishes or the content of the document. We cannot stress enough how important it is to sign the advance directive and ensure the document is correctly witnessed. Without signatures, the entire advance directive is incomplete and invalid. A person may complete any other part of the advance directive and Part 4, and the document is legal and complete. For example, one person may wish to name a healthcare agent in Part 1, but choose to leave Parts 2 and 3 blank. Once signed appropriately in Part 4, the document is legally complete. Someone else may choose to complete Part 2 and select their treatment preferences, but choose to leave Parts 1 and 3 blank. Once signed appropriately in Part 4, the document is legally complete. Once completed, we suggest you provide copies to the following people: your healthcare agent and backup healthcare agents, your primary care physician, any other physicians you see regularly, any hospital where you may find yourself a patient. Note that a copy is legally equivalent to the original. You do not have to present the original advance directive for it to be valid. We hope you have found these short videos on the advance directive helpful. The advance directive can be an extremely important document, and we hope you will consider completing one. While sometimes difficult to talk about, it's much better to talk about your wishes for medical care before you are in crisis. Once completed, an advance directive can give you and your family peace of mind. We also find that an advance directive can prevent family conflict because your wishes are written down for everyone to see. Thank you for your time and attention to this important topic.